Hello everyone. We'll be covering the standard treatment guidelines for the common conditions. First one will be fever. Fever is a body temperature greater than 37.7 degrees Celsius. So it could be continuous, intermittent, remittent. So what will we do first? First we'll be taking the history. In history, do not miss the occupational history. When you're eliciting the history, the symptoms have to be recorded in a chronological order. After this, thorough physical examination has to be done. If none of these provide any clues, blood investigation is the next best choice. So, CBC with ESR and fever profile has to be sent. Urine analysis with culture. If the febrile illness is prolonged for more than 2 weeks, chest X-ray is indicated. Now coming to the treatment. Antibiotics is not indicated if it is a low-grade fever because it will mask all the clinical indications. So it could be viral, bacterial. Either way, the fever has to be treated. So we will divide the treatment into non-pharmacological and pharmacological. Non-pharmacological is hydrotherapy and rest. Pharmacological is again antibiotic first. So tablet, paracetamol, 500 mg to 1000 mg, 6 to 8 hourly. Or tablet, ibuprofen, 400 to 600 mg, 8 hourly. So, if to be specific in pharmacological treatment, antibiotics, antimalarials are suggested based on the clinical history and the laboratory investigations. Other things which are helpful in the treatment are like avoid covering the patient having high fever with blanket. Plenty of fluids will help a lot. Stay in a cool environment, and cold sponging, face, limbs should be done repeatedly. If the diagnosis has not been made, even up to 3 weeks, patient is having fever even after that, then the patient is said to be having fever of unknown origin or pyrexia of unknown origin. Now we will cover fever of unknown origin or pyrexia of unknown origin. It is said to be fever of unknown origin if number 1, temperature is more than 38.3 degrees Celsius, recorded on several occasions, not only once. And then the fever is not resolving even after 3 weeks. Actually, there is no diagnosis after 3 weeks, even after 1 week of relevant investigations. Even after 1 week of relevant investigations. Investigations assigned CBC with peripheral blood smear with fever profile. We will also be sending liver function tests, tuberculin test, chest X-ray when the fever is prolonging. Other investigations could also help if the condition is related to collagen vascular disease. Then USG can be done to localize the intra-abdominal foci of this infection. CECT can also be done of chest and abdomen to detect mediastinal lymph nodes, parenchymal lung abnormalities, which are not seen on chest X-rays. FNAC or biopsy can be done for suspected doubtful lesions, any abnormal lesions. So sometimes it could also be drug fever. So to rule that out, it might be useful to discontinue all the drugs that are being taken by the patient. So that is it about fever. Thank you.